Hello, I'm Janine and this is Vipin. Today we're going to discuss Steve's case study about his alcohol and drug misuse as well as his psychosis. We're going to start off with assessment tools that we could use. So when just meeting Steve, when he discusses about his alcohol use, we would use an assessment tool called the CWA. And that way we can go over to find out just how much alcohol he really is drinking and assess what his withdrawals may look like. Other assessment tools available is we can use our SIGE caps, which will assess for major depressive disorder, as well as our DIGFAST, which it's going to assess if the patient is in mania right now. However, if it is drug-induced mania, it's not going to be accurate for bipolar, but it's a tool we can also use once he has been off drugs for a set amount of time. The last
Thanks,
assessment,
Janine.
sorry,
Yeah,
there's one more
yeah, sure.
assessment. A SAD person's assessment will help identify his risk of suicide as well. Sorry, go ahead.
Okay. So when it comes to his mental status examination, Steve is a 24-year-old man. He presents in casual dress, which is appropriate for that interaction. He seems to be cooperative, but shows some signs of irritation. He avoids eye contact and interacts only upon approach. His behavior is guarded, providing limited responses and exhibiting paranoid thoughts, specifically expressing the belief that bugs are crawling from everywhere. His affect is broad, which is congruent with his emotional expression of fear and anxiety. His speech is coherent without any notable issues, um, and Steve presented with rapid speech and flight of ideas jumping from one topic to different. He experiences visual, tactile, and auditory hallucinations, seeing, hearing, and feeling bugs crawling everywhere on him. Cognitively, Steve struggles to express his thoughts and follow conversations with poor attention and concentration. No suicidal or homicidal ideations were expressed during this interaction with the writer.
Thank you. So after doing an MSE, we thought the most important nursing diagnosis to start with was disturbed sensory perception because he speaks about feeling the bugs, he hears the bugs coming and he sees the bugs. So because he's currently having visual, auditory, and tactile hallucinations, we decided disturbed sensory perception. It's related to substance abuse, and the evidence by that is the fact that he does tell us about his hallucinations, but also that he reports using speed, ecstasy, and excessive alcohol.
So, moving to the interventions, the number one intervention is use of antipsychotics like olanzapine, which helps to reduce psychotic symptoms. This can be used for short term while detoxing from the drugs, as drug-induced psychosis usually occurs for 30 days after discontinuation. Olanzapine will help with the patient's symptoms of psychosis and help him get back to reality-based thinking.
Another intervention we thought was very important was educating the patient. He doesn't seem very insightful about the fact that the frightening experience he had is related to the drug use. He seems to think it's not really a problem. So I figured educating him more about the drug-induced hallucinations and psychosis, so he can understand the link between the substance use and his frightening experience. Also, he doesn't seem to fully understand the consequences of substance use. So educating him on what could happen in the future if he continues to use as well. And then in the future as well, educating him about relapse prevention and programs available as well.
Yeah, based on this, we set two smart goals. The first number one is reducing his alcohol consumption and stopping the use of speed. So, which is a specific goal, and this can be measurable, like by reducing the quantity of alcohol from 2 pins to 1 pin. And he we gave like 30 days time. So within that time, he can use the medications to manage withdrawal symptoms um, given by the healthcare provider, and also includes a safety plan with coping strategies, and we can discuss with the therapist. So the ultimate goal is to reduce substance use and manage withdrawal symptoms in 30 days, which is time bound.
Mhm. Um, so our goal number 2 is preventing the relapse. So Steve will be able to identify his triggers that cause him to misuse drugs and have a plan in place that includes a list of contacts, which he can call immediately for support when having cravings. This is going to be measurable by a drug screening test. And we're going to do a drug screening test prior to an appointment with the care provider. We're gonna attain this goal by weekly check-ins with the therapist. Having him have weekly check-ins with his therapist, and a plan in place and to review that plan and make necessary modifications. Also, our time frame for this is going to be 1 month of not relapsing, and he's going to stop the use of speed and reduce his alcohol consumption. Which will hopefully help in the recovery of his psychosis. And yeah, the next one is evaluations.
So the evaluation number one is Steve reduces the amount of alcohol consumption as we specified in the goal, which is from 2 to 1 in the time period of 30 days. This is evidenced by his less hallucinations and also by negative drug screening test, which is done at the end of the 30-day period.
Okay, and our second evaluation, Steve admits he's used speed 3 times in the last month. So we want to evaluate the patient's antipsychotic treatment. We want to determine its effectiveness and if it's providing the therapeutic benefits. We want to make sure that the antipsychotics are working for him. Has he been adhering to the medication regimen? What triggers did he experience prior to using again? Identify his mood prior to using again. Did he call anyone from a support network? And just overall evaluating his self-determination in the recovery process.
Thank you.
Thank you.